Hello class, so for this week, for discussion 4, we're asked to discuss the interdisciplinary model and the down-home model and compare and contrast their differences and similarities. So for the interdisciplinary model, it talks about in the reading for this week how the usage of resources on a bigger level in the community can be beneficial to the client's care. It states on page 64 that churches in rural communities may not always be as skilled in mental health or substance abuse and things like that, or being able to identify when a person of their church needs help. Many people in the community want to go to their church or to other resources for help, but the church may not always know how to deal with that, or other resources in the community, lower level, may not always know how to handle that. So the interdisciplinary model focuses on the usage of resources from the educational system, such as working with teachers, principals, people on a professional level in the educational system, as well as in the psychological professionals like therapists, clinicians, things like that, or working with the court system, such as judges, lawyers, people who are professional and can help the client better fit their needs. I think that using these resources in the interdisciplinary model may help fit a client who is in mental health distress in a rural community or needs more help than what the lower level can provide. In the down home model, it uses a strengths-based perspective to better fit the client's needs based on the strengths and assets of the client. Considering the case study that it showed on in the text, it talks about how that family needs help and they don't want to go to their church because they don't want to be embarrassed. But the social worker also thinks that going to lower level may benefit the client, as well as helping the husband who is having trouble with his back get to a medical professional as well. On page 227, it states that the case study uses generalist method, social exchange, and strengths and assets from the down home model for rural practice. So on that level, it wanted to focus on the strengths of the clients and her family, such as their church, their community, resources that would be beneficial to them, as well as helping the husband get the medical care that he needs out in another city, by helping them get their repairs that they need on the house by using the community resources. So I think that the interdisciplinary model focuses more on a macro level, using the professional resources that are provided in the community with leaders of those areas, such as the school system, the psychological care that the client needs, and also the court system, just using professional help to help that client. And then the down home model wants to focus on the strengths of the client and the relationships that they have in the community to better care for them. And that would be in the case, such as the case study in the text that talks about the client's need for repairs on their home, medical care for her husband, and how they're low on money because he's not able to work. So they would focus more on the community-based level in that type of situation. In the situation with the interdisciplinary model, the client may need more professional help than what can be provided by just the community. They may need mental health, substance abuse treatment, or other types of treatment such as therapy, things like that to help the client better suit their needs. So I think that's really the differences between both the models. They both focus on meeting the needs of the clients, but I think the down home model focuses more on the strengths of what the client has available to them at the moment. And then the interdisciplinary model will focus on what the client needs to obtain to better suit their needs mentally, physically, things like that. But that's it.